Let's walk through the different components of an ET tube. So this is the ET tube, and this is the portion that goes inside the patient, down into the patient's trachea, and this is the end that's connected to the ventilator. This balloon right here is referred to a lot of times as the cuff, and this is what is inflated to kind of help hold the breathing tube down in the patient's airway. You inflate this cuff by the pilot balloon right here. This has a one-way valve, meaning you can insert air in, but air should not be coming out. So you can inflate and deflate the patient's cuff by using the pilot balloon. You can see this component here. This is not on all ET tubes, but a lot of them have this. This is your subglottic suction. So this is different than your inline suction that is connected with the ventilator. The subglottic suction actually suctions secretions that are kind of sitting on top of the patient's ET tube. So sometimes patients are really drooly and a lot of that's going back down their throat and then it's kind of just chilling on top of this balloon. We don't want those to go down into the lungs. So sometimes we'll hook up our intermittent suction to the subglottic suction component. You can see a bunch of markings on the ET tube, and there's a couple things that the ET tube will tell you. One, the size. So we can see that this is an 8.0 ET tube. It also shows you the centimeter markings to help you identify how deep that ET tube is placed. So for example, if you hear someone say the ET tube is 24 centimeters at the teeth, they're identifying that this marking is the component that is outside where the patient's teeth are.